Satish, I remember you had foot drop, and in spite of that, you went about completing a marathon, and I guess you underwent a surgery. In a normal scenario, I'd seen that people they stop running, or I don't, or probably their doctor might have asked to take a pause. In such case, what is your suggestion, and how did you went about completing a marathon? Is it because you're an orthopedic surgeon, you had an extra knowledge how to overperform? Okay, so can you give us some insight about it, what actually happened?
See, I had a foot drop because one of the discs in my spine had been pressing on the nerve. It's been a problem which I had for many years. But then suddenly your foot stopped functioning where you cannot actually lift up your foot. So I underwent a surgery. Yeah, I remember one of my surgeons, he came on rounds the first day. He said, when I asked him, when can I start running? He said, it'll be years. But when you're passionate about something, the basic fundamental idea of a doctor should be that he should be able to get me back on my feet and allow me to do what I was already doing. That should be the goal of any orthopedic surgeon or a goal of any doctor, that you try to get the person back to his pre-injury levels. So even though he said it will be years, me having some knowledge about orthopedics and being an orthopedic surgeon myself, I took rest for about, I don't say rest, I would say I took rest for about 6 weeks. Then I slowly started walking longer distances, and then I went to start running again in about 3 months. And I was listening to my body basically. The body was allowing me to run. There was no pain, and my foot was slowly improving. I was regaining my muscle strength, and it was allowing me to run. So I started training again, and about 6-7 months later, I think I did my first full marathon. And I'm thankful that I was able to get back to this level. The most important thing is that I don't think we should stop anybody from doing any of their activities. If they're passionate, we should try and help them to get back to their levels. There will be very few instances where you cannot allow them to get back to their pre-injury levels. I'll give you another example. Other than myself, there was another marathon runner, a good friend of mine, who was getting multiple injuries because of his pace and his running continuously. So what he was advised was that you reduce your pace. From trying to run fast, you reduce your pace, and maybe you can increase your distances. So from being a marathon runner, he is now graduated to being an ultra marathon runner. So he runs 50 kilometers, 70 kilometers, 100 kilometers, but at a much slower pace, at 8 kilometers per hour or 9 kilometers per hour, and then he completes all these races. So I think minor modifications in the way you do things, but we should be able to get them back on their feet.